Alachua County is in the midst of its Discover 200 bicentennial celebration. We're celebrating the past, the present, and the future. I'm pleased today to shine a light on an organization that has been integral to the county's history. Phil Kabler is the Chief Executive Officer of CDS Family and Behavioral Health Services, Inc., a nonprofit corporation serving children, youth, young adults, families, and the communities of 11 North Florida counties. CDS provides residential and non-residential behavioral health services, school and community violence services, and delinquency and substance abuse prevention education. He graduated from Brandeis University in 1982 and from the University of Pennsylvania Law School in 1985. Mr. Kabler taught at the University of Florida Levin College of Law and the Warrington College of Business and at Santa Fe College. He also worked at the Florida Department of Juvenile Justice. He is currently involved with a number of community organizations, including the Greater Gainesville Chamber of Commerce Board, the 8th Judicial Circuit Local Professionalism Panel, the Florida Network of Youth and Family Services, the Florida Juvenile Justice Association, the 8th Judicial Circuit DJJ Circuit Advisory Boards, and the Rotary Club of Gainesville. He served as the president of the 8th Judicial Circuit Bar Association and was a member of the Florida Bar Foundation. Welcome, Phil.
Welcome, and thank you. And I guess our time is over now. It's been nice speaking with you.
You know, it has. Your bio was so full. That's all the time we have.
Yeah.
Actually, you know, it was funny, reading your bio, I could have taken up the whole 28 minutes. You've had a very interesting career that has brought you to being the director of CDS. I came to the county for the first time in 1977, and back then, Corner Drugstore, as it was known back then, was already a very well-established, kind of iconic organization.
Mm-hmm.
Can you give us kind of just an overview of the origin story of CDS?
Sure. This is actually going into our 55th year come March. And it was CDS has had a number of different names. CDS has been our name since 2007, but a lot of people who've been around a while still recognize us by our prior name, which was Corner Drugstore. We're trying to remind people gently that we're CDS. But it actually started as an academic study. And I was going to bring a copy of it. We have one copy in our boardroom, but it says, "Do not remove upon pain of death." So I tried to.
I will come
that.
to you to read that document.
But the organization started with a slightly different mission. I mean, it was based upon, as I have learned, recreational drug use at the university and the community in the late 60s, early 70s. And so it was dealt with assisting, supporting, and treating students, at that point, adult students. As we moved along, the name changed a few times till we got to Corner Drugstore.
But going back to the 60s, so this was kind of a safe space?
Exactly, what I'm told.
Non-judgmental space?
Yes, what I'm told is people, students could bring whatever they were going to take there, and it would be tested for purity and safety. And along the way, it was also treatment efforts were made at that point. But that's a long time ago. Right. We've been out of that business for decades. At some point, we got out of the adult drug treatment program, and that was taken over by other organizations, and we took on the delinquency prevention work. And so 2007, to align the mission, to align what we're doing, the board at that point changed to CDS, Family and Behavioral Health Services, which is closer to our current, it's closer to our mission. We serve children, right, youth, families in 11 circuits in North Florida. So all the way from the south of Alachua County, all the way up to Hamilton County, so Georgia, over to the Gulf with Levy County, and almost to the Atlantic with Putnam County, Palatka.
Has the nonprofit just expanded into those counties, or do you have direct relationships through the state or the counties, or how does that work?
Well, it's always been that turf since I worked at DJJ. It's interesting because when I worked at DJJ at the local level, as you put it, I actually managed this contract, at least the youth part, for the Department of Juvenile Justice. So it's always been those 11 counties.
I see.
So
the state, somehow that evolved into the state understanding that you were doing
Well,
something effectively, and
we have contracts with the state and the federal government. So a lot of our work is through through our shelters and behavioral management counseling, and a young earliest prevention is through it's the Florida Network of Youth and Family Services, who is funded by the Department of Juvenile Justice. There are about 30 of peer agencies like us throughout the state. We got a lot of real estate. There are some that have smaller but even bigger populations. But we also get funding for school-based violence and substance abuse and delinquency prevention through Lutheran Family Services, which they get their funds in turn from Department of Children and Families, which in turn gets their funding from the Federal Substance Abuse and Mental Health. And then we also get some funding through HHS, Administration for Children and Families, one of their grant programs.
I see. We've had some drama in the last couple of days about federal funding, but hopefully that pipeline is flowing.
Well, I mean, I can tell you, in the interest of the children and communities we serve, we are obviously following it very closely.
Right.
So, I mean, it's right now, the memorandum, not the order involved, is on temporary hiatus.
Right.
And we will all have to see. I mean, I can tell you, my peers, we've all been following it together. On the other hand, what we are doing is making sure, as with all things, all challenges that confront us, is we keep our focus on the kids. It's kind of like it runs in the background. It's all about the kids.
Speaking of kids, I did not know that you ran youth shelters in some of your counties.
We have 3. I'll come back to the one in Gainesville in a minute.
Okay.
We have one in Gainesville, we have one in Lake City, and one in Palatka. The Gainesville one has been in the news the last couple of years because we used to have a shelter that was on Northwest 13th Street, and it started, well, we got funding from the state, thanks to Senator Keith Perry, Senator Jennifer Bradley, then it was Representative Clemens, Representative Brannon, for funding to build a new shelter. And so I learned some terminology. We built a new 20-bed shelter, what's called the old entrance to the airport, meaning on northeast 39th Avenue.
Right.
And so it came online right in the end of last year. So we've got that shelter, and I'm quite happy. Our board agreed to sell the old shelter to another organization, Family Promise, which deals with intact homeless families. So I was happy, and they're partners of ours. So we were happy to see it continue to be put to good use and kind of stay in family, in support of families.
Now, you are not like directly a part of the criminal justice system, is that correct? You're not involved in incarceration or sentencing.
No.
You're more dealing with kids before they get into that system?
Exactly. Where we fall in the Department of Juvenile Justice, because that's one of our major funding sources, is through their Prevention Services Department. So we're in the prevention continuum.
I see. And what is the criteria for a youth staying in your shelter? What types of situations are they in?
Our different programs have different age and other needs. So we go all the way from 6 to 17. At the shelters, it's 10 to 17. And so we deal with youth who are truant, runaway, next is a state term, ungovernable, homeless, runaway, and trafficked. The youth can't have an active DJJ case or an active Department of Children and Families type of referral. So, but we do work with DCF, by the way. We do some emergency shelter placements periodically through another partner of ours, Partnership for Strong Families.
Right.
So we are on the prevention end. If we do our job right, the youth go back to school, they return to families, and they're career ready at some point. We don't do career prep, but we get them back engaged in school and community.
I've noticed through the years that the spokes coming out of that CDS hub are going in a lot of different directions, working with a lot of agencies.
Mm-hmm.
And I wanted to make sure that we had an opportunity to talk about Safe Place.
Yeah.
And what that program provides.
So I mentioned briefly in passing about our federal funding. It isn't funded, but Safe Place isn't funded. Safe Place, by the way, for folks who don't know, if you walk around town and you see these yellow, they look like stop sign, but they're yellow and says Safe Place, that is, it's a private program, but supported by the federal government. And any youth who feels at risk, endangered, they're being followed, they don't know what to do or where to turn, they can go into any safe place. There are private businesses, there are county, there are city, they're all over our 11 counties, and they will contact us, the closest shelter, who we will pick them up and we will deal with their screening and intake and services. And we are, by the way, one of our cultural issues is we are not a closed door agency. That was a double negative, meaning anybody who comes to our door, even if we can't service them, we will get them to the right place. We've had adults show up at our door.
Right.
And we help them. We have a program called SNAP, which is Stop, Now, and Plan. Nothing to do with the food stamp program, but as you might imagine, we get calls. We will get them to the right place.
Right.
So we are not a closed door agency.
And is it through Safe Space that you work with the National Runaway?
National Runaway Safe Line?
Safe Line, yeah.
They're two different organizations, but they are aligned. And one thing I want to make sure, you kind of adumbrated it, is we don't deal with bad kids.
Right.
We deal with youth who are in tough situations and families, and we help to realign. But we don't have bad kids. And by the way, our programs are voluntary. So, we have to work with families to get the children in. Whether it's our non-residential behavioral counseling services community, whether it's the shelters, whether it's our SNAP youngest family programs, whether it's our school-based programs, whether it's Safe Place.
Right, right. Now, have we touched on everything you do? I mean, have we gone over the full menu of services, or?
Well, I'm looking for, you said at the very beginning of this, you talked about past, present, and future.
Right.
So we've touched about past and present.
Right.
Future, we'll see where we go in service of the children, youth, and families, and where our board is willing to go. But, we're always researching and looking at other areas of service.
You mentioned your board. Are they all from Alachua County, or is it spread out?
Yes.
Okay.
I know that it's a complex word these days, but I'll use it from the business context. We are a very diverse board, meaning, yes, we deal with the traditional sorts of Title VII diversity. We've got members of our board who are white, who are African American, men, women, Latinx, all of that. But more importantly than that, or pardon me, I shouldn't say more importantly, in addition to that, we have professional diversity and locational diversity. We have 11 counties. Mm-hmm. Gainesville's the big city. I mean, we've got some very rural areas. So our board is not all from Gainesville. And we do things to make it easier for folks who aren't, like our board meetings, our committee meetings, we have them in person with Zoom options, virtual options to have folks engaged. So we've got some very active members from outside of Gainesville and Alachua County as well.
And is Alachua County where your kind of administrative headquarters is?
Mm-hmm.
Do you have locations in different counties? Or?
Yeah, again, we've got
I know the shelters.
The shelters, and we've got another building in Lake City. Okay. And our offices are in Gainesville.
I see. And how many employees, or?
About 110.
That are on the payroll?
Mm-hmm.
Is that right? I had no idea.
Yeah, it's a good, yep.
Yeah. And these folks branch out into the 11 counties, or?
Yes.
Yeah.
Mm-hmm.
What is a what does a day look like for someone who, say, has Levy County on their responsibility, and they live and work here, but
they can live and work there too.
Oh, okay.
It depends if they're in the schools,
Okay.
or if they're a counselor. They would meet with a kid, family, in the schools, in their home, anywhere in public, and engage in behavioral management counseling. A shelter worker, which would be in Gainesville, Lake City, Palatka. It's the rule. You were in marketing. It's the rule of threes. If I say it 3 times, people will remember it.
And if you say it 6 times, it'll be true.
Well, we have 3 shelters, so 3 times 3, 9. But they will deal with screening youth we do a lot of cross referrals inside, and cross referrals from other agencies. We have cross referral agencies from our other 29 or so peer agencies, but they'll do intake, they'll do screening to see if they're proper and we can help them, and then they will start the kids in the program. They do individual, group, and family counseling in the shelters, behavioral counseling. We get them to schools, we get them back from schools. We feed them. They spend the night in the shelters for, I think the average is 25 to 30 days. This is one of the most telling things, is we did an open house at one of our shelters, and they brought in 2 older teen youth, closer to the 17, and they said, what do you like about this? What's the positive? And they said, well, firstly, the folks who work here, they're called youth care workers, listen to us. Second thing, food. And third thing, which I kind of found crushing in a way, is they said, I can sleep here.
Oh,
which said to me, what are their environments they're coming from that
Right.
make it that they can't sleep comfortably?
Right. You mentioned partner organizations. I know you work with, it seems like dozens
Yes.
of different, and
Just
these,
all over the lot.
Yeah.
We deal with other ones that you would know of in the communities. I just said Partnership, Meridian Behavioral Health Care, or they've changed their name, Meridian Health Care.
That's right.
Other one, Care Connect plus Brave, just a large number of them. But also we are engaged more now in the business community. We have partnerships with, I guess from my bio, it's not going to surprise you, with the 8th Judicial Circuit Bar Association, with the Chamber of Commerce, with Rotary Clubs. So we're involved in any number of different organizations.
Can you take me through, I'm fascinated that, for example, a child at school is having issues. You have a system to where the school knows that you are a resource they can use?
Yep, referrals.
A referral.
Can come in a number of ways.
Right.
Telephone, happens all the time.
Right.
Also, we have a website like everybody else, but we get referrals from kids themselves. Just talked about Safe Place.
Right.
That's one way. Parents can call us up and say, my youth is a little out of control, we need a respite, we need a break.
Right.
The schools can call. They can say, you've got a youth who's truant, who's acting out, and then law enforcement as well, not the criminal justice side, them being communities stewards and servants, they will help us too. And then of course, there are certain, under the statute, it's not on the criminal side, but where we can get some referrals through the court system, for example, for youth who are truant. But referrals come any number of different ways.
And is that a two-way thing? You also, when you fully understand the circumstances of a child, you can refer them out to
Yes,
available services?
I mean, I was at one of the shelters where I was visiting. I like to visit with our team, we call them team, and just see what they need and how's it going. I don't bring a white glove and check, although we are, in fact, we have a culture of being always audit ready.
Gotcha.
At any time, but I was just there and someone knocked on the door and it was a parent with their kid and just said help. So, yeah.
Do children reach out sometimes? Children who have less than good circumstances at home? And do you get involved in mediation efforts between parents and children, or?
Yes, yes, and yes.
Yeah.
I mean, that's
Okay.
part of the behavioral management counseling that we do. It's just trying to reconcile. I mean, I've been in our office, where the Gainesville office for the community counseling. And every day I see parents may be waiting in the lobby or something where their kid is talking to one of our counselors. The SNAP program, which is an evidence-based 13-week program. It's in the schools, but it's more in our office here in Lake City, where they've got sessions with the youngest kids to cut off even the pre-delinquency, where it's just a child may just show those first signs of acting out. And so they come as a family unit. We have dinner for them. I'm not going to say it's a 5-star dinner. It's pizza. And we have childcare so that we can get the families there and engaged. And if we can get them communicate, we break them up. We've got boys groups, girls groups, separate. We break up the kids and their families, and we've got educational programs about things such as communications, building what we call cool thoughts, and making hard thoughts cool thoughts.
Nice. Do you have an idea of how many clients you've served in 55 years? I don't mean to put you on the spot there, but...
It's well into the 5 figures.
Is it really?
Yeah.
Yeah. Do you know how many you serve in the average year in current day?
It's a hard answer. And, well, it's hard to answer because, sure, we've got the ones we can count the noses of, meaning the kids in the shelter.
Right.
I mean, the kids in the shelters, individual, well, it depends, but, or kids in counseling or kids in SNAP, those you can count noses, but we serve elementary and middle schools, so it could be thousands of people we touch in a course of a year. Another thing I didn't mention, but straddling all of that, is we have outreach services. And so we have folks who are all over the place in the counties trying to let people know what we do. It's almost like a pre, 2 steps removed, pre-screening. Here's what we do. If we can help you, we're here. Oh, we can help you? So.
Do you work with the Children's Trust here in the
Yes.
Yeah.
We go to all their meetings.
Yeah.
Or if I don't, one of our people goes to all their meetings.
Right.
We've been thank you for pointing that out. We're also involved with the Community Foundation, North Central Florida, Northeast Florida. We are making an effort in the last, we've always done it, but we're really making a concerted effort to be everywhere as often as we can. I mean, we have a long track record, long before I got here. But I come from the business community, so I approach things from a business sensibility. So it's marketing and bringing people in.
Right.
So that's why, at least from what I do, that's it. But we've got really good team members. We've got some people who are dedicated outreach, but everybody in our place is an ambassador.
Right.
And
so speaking of marketing, if you were doing a 30-second spot to get information to parents and children about why to contact the CDS, about what you have to offer, where you go, who you call.
Sure.
What would that be?
Well, firstly, I'm looking at your little questions and going to turn it over because, as you know, I can read upside down and backwards. But we recently rebranded, and it's our mission. Let's start from there. It's empowering youth and building strong families for a brighter tomorrow. Right. That's the message we want to convey. Right. But the elevator pitch, as I was taught by a lawyer friend who's really good, is we help kids, youth, and families. If you are having a struggle, come to us, 352-244-0628, or go to our website. Start with us, and if we can't help you, we'll get you to the right place.
Okay. So there are ways to do intake on the website, or
there's a lot of self-referral, and people can contact us, and then we'll reach back out to whoever it is.
Right. So I'm sure there are dramatic stories of young people who have come to you, and I'm sure there are outcomes that are, very fulfilling. I'm sure there are outcomes that are heartbreaking at times. Are there any stories that stick out in your mind? And I'm not asking you to name any names, but can you share with us?
Well, I'm going to be honest because of what I do.
Okay.
I don't really see a lot of the cases, the kids
Gotcha.
in the halls, although I have taken the SNAP course
Okay.
to be a facilitator. There are little miracles that happen all the time.
And I'm sure your employees talk to you about that.
Yeah, I mean, we focus on them. I mean, we have it's based upon, to some degree, the outcomes are based upon a little bit our management style. We use a reverse pyramid, where the most important people in our company, we are a business, not for profit, but a business, are the people who touch the children, youth, families, and communities. That's who we're focused on. They're the ones who work the magic. They're the ones who deal directly with them. And sure, they're all, I hear all the time about youth who have turned their life around, or they come back, or they thank us. I mean, from what I do, I know that we've done it right. Frankly, when we get a donation from a check from someone who was a parent or was involved, that meant, we engaged. So at what I do, that's kind of the way I can see the result. But our team members are just superstars. They're dedicated, they are passionate, they are creative, they are fully engaged in serving the children. That's why we have an upside down pyramid. We really focus on them. Then we've got managers, and then you've got two of us, kind of oversee the general end, but we're at the bottom. Our job is to support everybody, and their job, most of our 110, are to support the kids. Right. Again, in the end, it's all about the kids.
I love stories of people coming back and giving back after going through something like this. Well, this time has just kind of flown by. Maybe I need to have you back sometime, but
that's fine.
Thank you so much for sharing this. CDS is just a cornerstone of service and has been for so long, and you've been around for more than a quarter of Alachua County's existence. And thank you so much for coming.
Thank you for having us, and all I can say in conclusion is just watch us grow and watch us help the kids.
Thank you, Phil.
Thank you.
Every day in America, children are trafficked for sex. In schools, shopping malls, truck stops, clubs, and bars. Think it can't happen in your neighborhood? Think again. If you suspect a child is being trafficked for sex, call the National Human Trafficking Resource Center 24-hour hotline at 1-888-3737-888.
When it comes to making plans, you are the best. The same way you plan each detail for those moments, start planning to protect you and your loved ones from a natural disaster. Protecting your family is the best plan you can make.